Hi, this is Dr. Del Grosso at SF Chiropractic. I want to talk to you a little bit today about scoliosis, something that you hear a lot about and honestly can happen at any age, whether you're young, old, anybody can get scoliosis. Let's talk a little bit about it. Scoliosis is a curvature, an abnormal curvature of the spine. Now remember, from the front, your spine should be perfectly straight. It should be in line and straight. From the side, we have three curves, one in the neck or the cervical spine, one in the mid-back or the thoracic spine, and another one in the low back or lumbar spine. The one in the cervical and the lumbar spine are called lordotic curves, and they're like a reverse C curve. The curve in the mid part of the back, the thoracic spine, is called a kyphosis, and that's a C-looking curve, okay? And those are the normal curvatures of the spine from the side. But again, from the front, the spine should be perfectly straight, should look straight. In scoliosis, it's where there's curvature of the spine, whether it be an S-type curve or a C-type curve, okay? Scoliosis is described as idiopathic. Idiopathic means that we really don't know the origin or the exact cause of it, okay? And there's three different types of scoliosis. The first type, and the most common type, is called developmental scoliosis. Okay, and just like it sounds, that's one that you kind of occurs during the growth stages and during growth. The second one is called neurological scoliosis, and a neurological scoliosis is one usually that occurs before you're even born, during the process, during fetal development, or sometimes shortly after birth. Okay, and that's usually caused by some type of underlying disease such as cerebral palsy or muscular dystrophy, which causes a weakness, causes abnormal development of the bones, and causes a problem with the curve. In neurological scoliosis, the scoliosis is typically a big C curve. Okay, it's just in one direction, it's a big C, again, because there's weak muscles, because of a lot of things, and it is also the most serious of scoliosis. The third type of scoliosis is called degenerative, and it's just like it sounds. It typically occurs in older people over the ages, typically of 50, 60 years old. It's caused because of compression fractures, arthritic changes, degenerative changes of the spine, which causes the spine to curve and develop this abnormal curvature. Okay, let's go back to the original one, to the developmental. That's the most common. That's the one usually we see in younger people. We see in, teens or little post-teen developmental. With scoliosis, the most common is usually over the age of 10, which is typically developmental. Also, scoliosis is 2 times more likely in females than it is in males. Okay? Personally, I think the best time to actually identify and develop scoliosis, a true like S-curve scoliosis, is probably between the ages of about 13 and 16. That's the time to identify it, and actually the best time to work with it. Remember, during that age, between the ages of about 13 to 16, that's when you're in your growth spurts. That's when the body's growing the fastest and moving the quickest. And one of the problems with that is if you start to get a little curve like this in your spine, and you're during a growth spurt, your body has something called a righting reflex, which is always going to try to keep everything straight. So if you start getting this curve like this, and it starts curving and curving, and your body's like, no, we got to fix it, your body wants to straighten it, well, because of a growth spurt, the body overreacts, and that's where you get the curve that starts this way and then shoots back the other way, and you get that S-type curve. The good news is typically if it's identified early like that, again, between like 13 and 16, the best time to work with it, we can use exercise, maintain joint mobility, a lot of different things to try to make some correction and fix it. Because remember, a big part of correcting a scoliosis, especially early on, is muscular, is to try to work with it, to try to work with that straightening, work with the muscles, do exercises, get good balance to strengthen and try to re-straighten. As you get older, the scoliosis, a big part of it is maintaining joint mobility to keep those joints mobile, keep everything moving, and keep this arthritic stuff from starting to fuse the spine and make those curves permanent. Okay, scoliosis is something that can be actually dealt with at any age. Just because you hear, well, I'm older, I've had it for all these years, I can't. Well, as long as there's some mobility in there, we can make some changes, and we're not going to make your spine perfectly straight, but we can make some change. We can make you more comfortable. We can get better strength in there. We can get better balance, better joint mobility, and actually help you quite a bit. So please, if you think you have scoliosis, if you have children that you suspect might have some scoliosis or something, bring them in. It's easy to evaluate. It's not hard to identify. Sometimes just by looking we can identify certain things like the pelvis being imbalanced or the shoulders being imbalanced or something that can be an indicator. So come in, bring yourself in, bring your children in, let us take a look, let's see what we can do, and see if we can't help you with your problem with scoliosis. Thank you, and have a great day.